Hi, my name is Dr. Arvin Bagherpour. I'm an interventional radiologist, graduated from a Caribbean medical school and did my fellowship at the end at Cleveland Clinic. So I like to say I went from the Caribbean to Cleveland Clinic, which is a quite large task if you know what you're up against generally. I showed up to school and there were over 500 students in my classroom. And there wasn't enough space for me to even sit in my classroom. And unfortunately, that's not an uncommon experience since I started and since I've graduated. These medical schools, the majority of which are in the Caribbean, as a pathway since the early 1970s for students to become doctors and come back to the United States, are for-profit institutions. Not everybody sitting in the classroom with me made it through. Some students don't have the academic wherewithal and shouldn't have been accepted. So that's where we first come in at first, making sure that we accept high-quality students that have a good chance of getting into a U.S. and Canadian residency program. But the second step is making sure that we provide the educational product that they deserve. Classroom that's focused 100% on student success. Our school is made by physicians for physicians. All your classes are taught by medical doctors. We've changed our curriculum drastically, going to small classrooms, what we call flipped classrooms, and problem-based learning, and away from these large lecture halls. Our curriculum is designed, it's spent over 5 years in development, creating a program that's unique and specific to your ward experience and your board experiences. And it's taught by doctors. Every morning you go to a lecture before you break off into your small group sessions, and you may learn from the leading endocrinologists in the field of thyroid disease. You are not going to forget what you learned about thyroid disease that day. It's all integrated with your biochemistry, immunology, microbiology. It's not segmented. So you really learn something and you retain it. Our clinicals are done at U.S. clinical sites, and your electives can also be done in various prestigious institutions. So you spend 20 months in Dominica, just under 2 years, and the rest of your time is spent at ACGME. These are hospitals that have residency programs, accredited programs. And currently they're in Los Angeles and they're expanding in other locations throughout the United States and in Canada very shortly. At American Canadian School of Medicine, our mission is to train physicians of tomorrow.